Nice to relax on a Thursday night with a little 1920s music, right?
Love it.
Thanks everybody for joining us. We got about one more minute till go time. I see you, Miss Sue Hickerson. Thank you for joining us. Okay, well, that was well timed. Told you I was about to run out of tape. All right, I'm gonna go ahead and mute this computer over here and welcome everyone to this event. We've still got a few more people joining us. Linda Durkin, I miss you. Oh, it's good to see so many good, great names on here, people that have been so faithful to this organization. So thank you for joining us tonight. I'm Jackie Gibson. I'm the Vice President of Marketing and Business Development at Pillars Community Health. Joined on the screen by Sarah Parks from the Lagrange Area Historical Society. Here tonight to talk about 100 years of Lagrange history through the eyes of Pillars Community Health. Pillars Community Health is celebrating its 100th anniversary this year. We date back to 1921 in downtown Lagrange. And only one currently operating health center, free clinic, predates our organization. They beat us by 8 years. They're the Social Welfare Board of Buchanan County, located in St. Joseph, Missouri, going back to 1913. So I am going to go ahead and share my screen here. Maybe. And we're going to go ahead and look at our presentation. All right, so before we start, I want to give you a little bit of information about our organization in present day. So we offer medical and dental services, mental health and substance use disorder services, domestic and sexual violence services that includes 2 24-hour hotlines and our domestic violence shelter, Constance Morris House, and community outreach and prevention education in all of those lines of service. Today, we operate 9 locations that almost all of them have remained open the entire time during the pandemic, and all of our services have become available virtually, with the exception of some of our health center services that, of course, have to be in person. And all of our services are available regardless of your income or insurance. Some of our services are free of charge, and that includes our domestic and sexual violence services and Buddy's Place, our childhood bereavement program, which is headquartered in Western Springs. Our phone number is 708-PILLARS, and you can reach us online at pillarscommunityhealth.org. If you're interested, you can go to pillarscommunityhealth.org/100, the number 100. That'll get you to a overview of our 100th anniversary and our 100-year history. And you can also go to pillarscommunityhealth.org/donate if you're interested in donating. And we'll be joined a little later by Catherine Benashak from the organization to talk about other ways you can get involved if you're interested. But for now, I'm going to go ahead and turn it over to Sarah Parks to talk about the Historical Society.
Hi, everyone. Thank you so much for joining us tonight. I have been with Historical Society for about 4 years, and we were really excited to collaborate with Jackie and the Pillars organization to explore and review their long history in our community, which is really significant and interesting. So we're excited that this presentation has come together with all of Jackie's hard work, and we were happy to support that. And we just wanted to bring up a couple of things that we have coming up for our organization. If you're interested in virtual programming, we have a fun program about postcards, picture postcards and their history. They were actually created for the first time in the United States at the 1893 Columbian World Exposition. So we are sort of the birthplace of the American postcard in the Chicago area. And we'll have a speaker that is very knowledgeable on this, and she'll be weaving in some of our local postcards, like one that you can see here on your screen. And so that'll be kind of a fun local twist on an interesting story. It's called The Happy.
Oh, Sarah,
It's such a happy invention because it's a really great way to communicate what's going on with you. And the second one is the life cycle of clothing in the 19th century. And this ties into our current exhibit of women's fashions, which will be our grand reopening in April. We tried to open it last April, but as we all know, that presented some challenges. So we will have a grand reopening of our current exhibit in April of this year, displaying all of our women's fashions from 1880 through 1980. And we're going to have a speaker who's going to be talking a little bit about fashions in the 19th century and how complicated that was, the making of them, the mending of them, the taking care of them. So that'll be a fun tie-in to our exhibit. So hopefully you'll be able to view that program and stop in and see our local fashions from Lagrange. So that's just a little taste of what we have going on. And you can always, you can register for either of these programs at lagrangehistory.org and check our website anytime to see what we have going on.
Thank you, Sarah. And I just want to throw out there that I have stopped by and seen part of that exhibit, and I was lucky enough to look at it with Sarah. And if nothing, like even if you're not into dresses, just the way some things were, like the handiwork back in the days was amazing. I was really shocked by some of the handbags and things, just how people figured out how to put these things together in the 1800s. It really is fabulous. So Sarah, thank you for being here with us tonight and for co-hosting this event with us.
Thank you.
All right. I'm going to go ahead to see if I can flip through this, and if I have trouble, we'll go back and start this share again. All right, well, I've had the great fortune over the last couple of months to be organizing and reviewing our historical archives from, as you'll see, about 8 different organizations dating back to World War I. So that includes things like newspaper articles, like you see here, board meeting minutes, slides, handwritten notes, materials from our lines of service. And there's a lot, and I only have an hour with you because, as you'll see, Pillars Community Health is the result of a lot of mergers over the years, different organizations coming together. So there's a lot of ground to cover here. And because of that, I'm really just going to focus on the 2 that are a little bolder type on this slide. Community Nurse Health Association. Ultimately, we trace our roots back to 1921 at Community Nurse in downtown Lagrange. And then a little further down, you see South Suburban Mental Health Association and West Suburban Mental Health Association, which also have their roots in Lagrange. I'll mention some of these other ones just so you kind of see how we got to 2021. But if you're interested, there's another webinar this Saturday morning in partnership with the Berwyn Historical Society about Berwyn Cicero. And you can register for that event also on our website, pillarscommunityhealth.org. And there's also a Facebook event for that on our Facebook page. Anybody who registered also, part of the reason we asked for your email is so we can follow up with you after this event. I'm in the process of making a full booklet of our historical summary that we will send out so you can download it if you're interested in reading the full narrative. I could probably do 9 hours of these webinars and not get through everything. So there's a lot more here that you can read if you're interested. I also want to encourage during this time, if you want to type your questions or comments in the chat. I realize I didn't put all your beautiful faces on screen right now, just so we can focus on the slides. But I would love to see your questions and comments in the chat. So feel free to do that. So I mentioned Pillars Community Health goes back to 1921 in Lagrange. And hi, Anna. We go back to the local women's club. So put yourself in 1919. We're coming off of World War I, the right to vote for women. We're in the midst of the Spanish flu epidemic. And the local Lagrange Women's Club decided, as part of their local volunteerism, that they wanted to help with the needs of local children. So what they did was they formed a local chapter of the Illinois Child Welfare League that was called the Lagrange Public Welfare Committee. I refer to them a lot as the committee. It's the women's club, basically. They hired a male physician in 1919. His name was Dr. J.A. Gardner. We do not have a photo of him, to my knowledge. And he began examining babies in Lagrange every Wednesday in 1919 at the town hall. Later that fall, one of the women from the committee invited the state spokesperson for the Child Welfare League to come speak in Lyons Township about the possibility of hiring the area a school nurse and a community nurse. Now, this is before it was commonplace to have a school nurse. But as a direct result of that woman coming to speak to the women's club, a school nurse was hired for Lyons Township in 1919. Shortly after, on January 24th, 1921, our first paid community nurse was hired by the women's club. You see her here on the left. That's Jean McBean. And she began by providing well baby checkups out of the back of H.P. Smith's pharmacy in Lagrange, located at Hillgrove and Stone Avenue. She also did some well child checks in other donated spaces throughout the community, including the Lagrange Public Library and the Township building, which is today our village hall. She worked 6 days a week, and Dr. Gardner assisted her 1 day a week. And her salary was $150 a month, paid for entirely through fundraising by that women's committee. In just 2 months, that committee raised what is the equivalent of $38,000 today to pay for the services that she would be providing to this community. Okay, and I'm going to show you another picture of Miss Macleod here. That's her on the left. And on the right, you see her pictured with Mrs. Charles Schwab. It is the case that throughout our history, women often are not named by their first names. Thankful that in present day, we get to have our first names written in the paper, but back then, a lot of times the first names are lost to history. But Mrs. Charles Schwab was her assistant. Now, let me go to the next slide here. 4 services were initially offered to this community. One of them, of course, being the well baby checkups and bedside nursing. Those services were free if the family made less than $12 a month, which would have been considered low income in 1921. They also offered, Nurse Macleod, but also the Women's Committee, was offering delivery of baskets of food and toys around the holiday. Many of you will remember that just 2 months ago, the Rotary Club, in partnership with Pillars Community Health and the Park District of Lagrange, put on the Secret Santa event. And that event starts right here at Community Nurse in 1921, the result of them giving out gifts around the holidays. We also started a thrift shop. It began as a continuous rummage sale in the library basement in 1921 by this women's committee. They thought they could do a rummage sale to help fund Nurse Macleod's services. That thrift shop became the community shop, which remained in our community in downtown Lagrange until just this last year in 2020. And I'll talk more about that in a bit. I know many of you have been involved with the community shop. And then this picture is the Mothers Conferences. This is the 4th service, chaired by Georgia Schwab, her Nurse Macleod's assistant. She is in the back right row all the way to the right, the back row all the way to the right. I don't know why I said that. And standing next to her is Nurse Macleod. Now, these Mothers Conferences are basically the beginnings of a prenatal program. So the mothers were invited to come together and have their babies weighed and discuss their nutrition. And this went on annually for a couple decades. And we have several pictures of those women coming together over the years. Now, I will step away from Lagrange a few times during this chat, again, just so you understand how we got to 2021. At this time in the 1920s, right, this is the flapper era, it's an economic boom. So more families have more money for healthcare. Now, at this time, this is if you needed a doctor, you waited till it was real bad, and then you called the doctor to your home. But as people got more money, the demand for hospital services and more regular access to healthcare increased. And that led to the mass accreditation of hospitals across the country. So McNeil Hospital in Berwyn just celebrated their 100th anniversary last year, and you'll see a lot of other hospitals across the country turning 100 right around the time of our anniversary as well. The thing that happened, though, is there's this demand for hospital care that prices other people out of quality care, and that's where things like community nurse and other social services organizations pop up. So at the same time that community nurse is getting started in Lagrange, the Berwyn Welfare Association forms in Berwyn. Out of basically the town council is getting an increase in requests for welfare dollars from low-income families, and they said, hey, we can do better than just writing you a check. Let's bring them some wraparound services, and that included things like free milk and access to a community garden. And again, I'll plug that webinar Saturday if you're interested in learning more about our history in Berwyn. Okay, we'll go back to Lagrange though. 1924, the association formally changes its name to the Lagrange Community Nurse and Service Association. And they raised enough money at this time to go beyond just medical and install a dental chair at Cosset School in Lagrange in 1926. 5 dentists volunteered their time to provide dental services to low-income children. Around the same time, we have the tuberculosis outbreaks. And so it was common in Cook County at this time to have TB clinics headed up by a traveling Chicago clinic, and Community Nurse partnered with that traveling clinic to offer TB clinics in Lagrange in the 1920s. Like Berwyn Welfare Association, Lagrange also distributed free milk to area schools through Community Nurse. This is before you could just go to school and get your milk with your lunch. That was not a thing in the 1920s unless social service and community nurse organizations were doing this for the schools. The organization also operated a medical equipment loan closet, which lasted until 2005. So for families that couldn't afford things like wheelchairs or crutches, they could come to Community Nurse and have them loaned out. I just love this newspaper clipping. It says, did you know the Community Nurse Association has put Lagrange on the map as far as welfare work goes? Visitors come from far and near to see the results of the work and ask advice. That's sweet. I'm going to show you another one here. That says Community Nurse has become a prop upon which the entire village has leaned, especially in these last few years of unsettledness. Now, if you'll notice the date, 1934, we have entered the Great Depression. And in addition to her nursing work, the organization and Ms. Macleod have also started doing additional social welfare work to assist given the economic conditions of the time. So this included things like making small loans to low-income families to help pay their rent, providing free eyeglasses, opening a childcare program for working mothers, and even opening an employment bureau to help men find work when they were out of work. They also increased local advocacy, which has been a theme since the beginning for us. At this time, it was things like advocating for the introduction of silver nitrate for newborn babies' eyes before that was common practice upon birth. The eradication of ragwood, urging vaccinations of dogs, and prohibiting dogs from local grocery stores. The other thing that happens at this time is that the community nurse in the 1920s is kind of the only resource people know of to bring their issues. So in addition to this advocacy work, some of the economic work, and of course, her ongoing medical work, people across Lagrange start to bring Nurse Macleod legal cases, things like deportation proceedings, concerns about child abuse, and so on. It all became too much for one employee to handle, as you can imagine, but clearly the need had shifted and increased, and the organization responded by hiring a social worker in 1932. Okay. So we are in the Great Depression here, some articles that really detail just how poor the economic conditions in the area were at this time. Some newspapers, the community shop is of course continuing to serve as a thrift store for low-income families and then use that income to help pay for the activities of community nurse. However, you can't run a thrift store with nothing in the thrift store. And I saw another article that's not on here, but they were literally saying, like, everybody go back through your house one more time and just make sure that there's nothing that you can donate to us. So little to place on sale, it made us heartsick to turn the poor people away. So you can really see in the articles from this time, and we have a lot of them, just how desperate the situation seemed in the Lagrange area, but of course across the whole country. Okay. In 1937, this is not pictured here, but I don't want you to stare at a blue screen, so I'm going to move forward. Community Nurse began sponsoring a year-long recreation program for the village. And by 1941, that program was moved under the village and paid for by a residential tax. Today, you know that as the Park District of Lagrange, but it in fact has its roots in the year-long rec program from Community Nurse. Fun fact. In 1939, the Episcopal Church in Lagrange donated its old parish house. Community Nurse then paid about $2,000 in that day money to move that house, physically move it to 218 Washington, where they opened the East Side Community Center. Eventually that would be replaced by the Park District Community Center, but you can see the kids that enjoyed the daycare center here. This article here is about the addition of a teeter-totter to their playground. Okay, we're gonna enter the 40s. We've left the Great Depression, but now we're in World War II. At this time, Community Nurse hired its first paid physician, Dr. Edward Baxter. Now, Jean McLeod is still there. Dr. Baxter is there to assist her. As you'll remember, J.A. Gardner was assisting her up to this time unpaid. Dr. Baxter gets paid $5 a clinic for each 4-hour clinic that he works. But pretty quickly after he gets hired, he gets drafted into World War II. So a female pediatrician is hired to replace him. She has my favorite name ever, Dr. Jean Mcbean. I really wish my name was Jean Mcbean. She was hired for $8 a clinic. So Miss Mcbean was hired for $3 more than Mr. Baxter was right before her. Interesting, right? At this time, Community Nurse moved out of that borrowed space in the pharmacy, back of the pharmacy at Hillgrove and Stone, into this larger space at 117 West Callender. You will know this today as the Metra parking lot on Callender Avenue. And that building at the time, if you look at this picture on the right, the pediatric and dental clinic was upstairs and the community shop then was downstairs. But this picture before it, so they got this space in 1944, and with the diligence of this women's committee who continues to work so hard behind the scenes to produce funding for the organization, they were actually able to pay that mortgage off within 5 years and burn the mortgage papers, which is pretty remarkable. This is just a fun one I wanted to throw in here. So Nurse McLeod retires in, let me not lie to you, she retired in 1944 after 20 years of work with us. She is the longest serving community nurse to this day that we ever had. She was replaced by Lucille Lord at the time, and they were seeing about 120 cases per month. But bless her heart, Miss McLeod did not go away. She is back in this picture, and she is teaching the local Lagrange Girl Scouts about bedside nursing. I thought that was a cute picture, and I'll give you a couple more fun ones. These are articles from the local paper. I'm sorry, comic drawings, I guess, not articles. On the left, that Secret Santa program, Community Nurse by now has definitely become known for its holiday gift giving to low-income families. And on the right, you see a drawing that the organization's office secretary made to show that the organization had quickly become more than just community nursing, that they were also doing welfare work, a daycare center, a dental clinic, and so on. And that appeared in their annual report the year of the drawing, and then also in the newspaper that year. All right, let's turn our attention away from community nursing for a moment. So we're in the 1950s now. We've left, we're kind of in a post-war boom. We've got the introduction of the civil rights movement, and an outcropping of the civil rights movement is something called deinstitutionalization. Big long word. This is a reaction to and against the abuses of state-run mental health institutions, some would call them asylums. That policy called for moving people with severe mental illness out of asylums and instead incorporating them into mainstream society, and then coming behind that with federally funded community-based mental health services, as well as new medications that would allow people with severe mental illness to live their best life out in society. Now, 2 local nonprofits sprang up out of the deinstitutionalization movement. One of those, which is the picture here, is from that program, Southwest Suburban Mental Health Association. It is a mouthful. I tend to refer to it as SSMHA, which isn't much better. They opened on 23 Calendar Avenue's 2nd floor in Lagrange. That is my present day office location. It was later purchased by Community Nurse and is a present day Pillars Community Health location. They opened in 1956 with the goal of prevention of emotional and mental illness in Lyons Township. And their clinic was said to be one of the only ones in the western suburbs offering mental health services to those who didn't have an ability to pay. Now, at the same time that they spring up at 23 Calendar, another organization springs up called Family Services of Lagrange. They later renamed with another great name, West Suburban Family Counseling Services. Their building is the present day Chase building at the corner of Calendar and Lagrange Road. So basically right now you've got Community Nurse and 2 mental health associations operating on one strip of Calendar Avenue in the 1950s. And this would go on until they purchased different properties, I think in like the 70s or 80s, and we'll get to that. So when we talk about it feels like we should have always had all these things under one roof, this is just another one of those moments where you're like, we should have just always been operating as one organization. Now there's a man who is responsible for a lot of this, and his name is Norman T. Welford. I'm gonna bring you back in time a little bit to J.A. Gardner, the first volunteer physician who worked with the Women's Committee at Community Nurse, right? He was the first one to assist Jean Macleod. When he left to go study abroad, and before we get Dr. Baxter with his $5 clinics, in the middle is Dr. Norman T. Welford. And he, in the middle in time period, these are all him on the screen, but Dr. Welford was a pediatrician. In addition to his time as the pediatrician for Community Nurse, he would go on to help found Lagrange Memorial Hospital in 1955, serving as its first chief of staff. And also in the 50s, you have to understand he's now spent 30 plus years as a pediatrician watching children either fall ill or even die as a result of what would become preventable illnesses. And so he turns his attention to behavioral health. Again, this is the time of deinstitutionalization. And he says, why can't we do the same thing for mental health that we're doing for pediatric medicine? And he gets really interested in seeing how he can be beneficial toward children's mental health. So he is actually the one who helped found both of those mental health organizations that existed along Calendar Avenue. So there's these 3 organizations working together, working separately on the same street, and Dr. Welford has his feet in all 3 of them. He would later recommend that the 2 mental health associations merge, which they did. In the 70s, they would become Community Family Services and Mental Health Association, which we call Community Family Services. And later, Community Family Services would give its biggest annual award, the Welford Award, in his honor. This is his obituary. He was born in London, Ontario, Canada in 1899, and he died at King Brewer's in Hinsdale. All right, we're gonna go on to back to that Calendar Avenue building for Community Nurse. Now, in 1963, the village of Lagrange bought 117 Calendar from Community Nurse to make way for the parking lot. With the proceeds, Community Nurse purchased 27 Calendar Avenue for its dental clinic, which is where we continue to have our dental clinic today on the 2nd floor of 27 Calendar Avenue. That had been Lagrange's first firehouse at the time. Remember that fact because it comes back later. This built location, 27 Calendar, had the pediatric clinic and dental on the 2nd floor, And then the first floor, which is currently our COVID-19 vaccine clinic and formerly the corner shop, that first floor housed the community shop at this time in the 1960s. With the donation of a dental chair from Dr. M.D. Cohen and a $100 donation from the Lagrange Rotary Club, Community Nurse opened its first official dental clinic at 27 Calendar in 1963. And women from the Lagrange Women's Club served as staff support in a volunteer capacity. And then they had volunteer dentists, including one who was visiting from Cook County Public Health. You see here the Lagrange Newcomers and Neighbors, which also still exists today, donated toward the opening of this clinic. From 1963 to 1966, 457 children from 19 area schools visited the dental clinic, and members of the school PTAs transported children to and from that clinic. I see this again as kind of like a real testament to this community, that everybody just bundles together to take care of their own and make sure that people have, as we say, access to the care they need when they need it. I mentioned that 27 Calendar housed the community shop on the bottom floor. So just a nice photo from this era. We have reached the halfway point. So if you need a stretch, take your stretch, because I'm about to leave Lagrange again. We're in Summit now. So at this time, you've got Berwyn Family Services, Berwyn Welfare Association happening in Berwyn. You've got these two mental health associations that are about to merge on Calendar Avenue in Lagrange, and you've got Community Nurse, well established by the late 1960s. In Summit is this building. It's called, locally, it's referred to as the Teen Inn. It's a rec center, but the cool kids don't see it as so cool anymore, and nobody's really using it. And the board that runs this place is like, well, yeah, but we know there's still this big social services need in this area. More or less, we kind of need like a rebranding, right? Fun fact, this building had at one time been a speakeasy and later a bakery. But at present time, it's basically sitting empty. So the board contacted Whole House in Chicago. And you'll remember, maybe you'll know, the Whole House was founded by Jane Addams to help with the social need in Chicago. And she had this phrase that she had a vacant building and a need. A vacant building and a dream. And that's what started Whole House. Well, Teen Inn is basically a vacant building and a dream. So this board goes to Whole House and they say, hey, we know you guys have never had like an affiliated organization in the suburbs before, but we have a vacant building and a dream, and there's a clear social services need out here in the western suburbs. Can you help us? And Whole House says, that makes a lot of sense to us too. So for the first time ever, Whole House gives agrees to have an affiliated community center, and the Des Plaines Valley Community Center is born. We call this DVCC, Des Plaines Valley Community Center. They're basically social service / like rec focused. Their only staff member at the time was Dr. Tom Jager, who oversaw things like tutoring and after-school ballet and arts program. He got a couple of volunteers initially from the VISTA program, which came out of President Lyndon B. Johnson's War on Poverty. He implemented a volunteer VISTA program. But quickly after, he hires his second staff member, and that is Florence Forche, who probably most people on this call know who Florence Forche is. Florence Forche started doing social work at DVCC with the assistance, of a few social work interns from the University of Chicago. Her first big launching for the organization is its Head Start program. Now, this is also timely because Head Start also came out of the War on Poverty movement from President Johnson in the 1960s. They started with 30 children and a rented station wagon. And in my conversations with Florence Forche, even just a few weeks ago, she said, we were not mental health focused at this time, but what we would say is that it didn't matter what door you walked through, you would get what you needed. And I had total goosebumps when she said that, because this is how we talk about our organization today. Our vision is to get you access to the care you need when you need it. It doesn't matter what care it is. If we don't have it, we'll refer you to the organization that does. So it's pretty cool to see some of the roots that came to, present day Pillars Community Health from this organization in Summit. Going back to community nurse, hang with me. Community nurse made a number of moves around into the 1970s now. Their daycare program that was the East Side Community Center that you remember from before was converted to a licensed preschool and moved to 100 Washington Street. And pretty quickly after, they moved again to a space at the First Congregational Church of Lagrange. Community nurse then made the decision probably about 10 years later in 1983 to close the preschool and shift that funding into primary care and dental services for low-income children. You see this a lot throughout our history, regardless of predecessor organization, that we pivot to meet the need. We regularly assess for and then pivot to meet the need. I mean, this was all of 2020. It was like, okay, everybody's remote and they need COVID-19 testing, and so let's go do it. In this case, there were so many preschools popping up in the Lagrange area that they said, okay, I think, these other places have it covered. Let's shift our funding back into pediatric medical and dental care. Again, 27 at this time, 27 calendar had dental upstairs and pediatrics, as well as the shop downstairs. And this is a picture of the community shop in the 1970s. Again, this is our present day vaccine clinic. So how times have changed. So they've got dental here, and then they've got this shop. And then in 1977, Community Nurse purchased a building at 6th and Harris, just around the corner in Lagrange, for medical services. So now they've got 2 buildings going. Fun photo time. This is the Lagrange Lions Club making a contribution to Community Nurse in 1970. We've got a variety of folks present here, including the Farm Club, Helping Hand, Camp Lions, and others, Boy Scouts of America. So it's fun to see all of the representatives coming together for Community Nurse. Mentioned earlier that Dr. Welford urges these 2 mental health associations that he helped start to merge, and they officially do in 1970. Dr. Welford is second from the left in the back row. And on his left, the far left, is Stanley Glickman, who becomes Community Family Services' first executive director. Now, at this time, they kept both sites. So they had 23 calendar from SSMHA and 14 South Lagrange, the Chase building, from West Suburban Counseling, and they kept them both. And then they launched a 3rd building in Summit for social work, and that would become known as Stepping Stone. I don't have it written down, but I'm pretty sure Stepping Stone was around until about 2000, 2002, doing social services out of that building. A merger sounds like it would merge a bunch of people. In fact, in 1970, after this merger, they still only had 10 staff members. Present day Pillars Community Health, we have over 250 full-time staff. So again, how things have changed. All right, we're in the 70s. Some new things happened for Community Family Services that merged mental health organization in the 70s. One of those is a variety of partnerships. Now, we rely on and love our partnerships across this organization today with schools, hospitals, police stations, and so on. And we really see this happen across our predecessor agencies beginning in the 70s widely. So that includes things like working with Helping Hand. Community Family Services ran a group for mothers of children with developmental disabilities at Helping Hand in the 70s. They launched their on-site social work at Argo High School in 1971, which would continue through the turn of the century. And we see the beginnings of a local council on aging, which was held at the Lagrange YMCA and funded by the Lagrange Kiwanis and Community Family Services. Something else is happening around this time too. It actually happens in the 60s, but we don't really see it till like the 70s and 80s. And that is the federal passage of the 708 Community Mental Health Act. It's called HB, House Bill 708, Community Health Act of, I think it's 1969. Now that bill federally says that local townships can charge a tax to their residents to pay for mental health services, but that doesn't mean that they're required to. And so our predecessor organizations and legacy staff began advocating for passage of the HB 708 referendum at the local level. We see this across communities in the boxes of archives. We see it in Riverside Township, Lyons Township, Berwyn, Cicero. All of our predecessor agencies are trying to bring massive awareness at this time to the need for mental health services to get these bills passed. It works. And the referendum was passed in Lyons Township in November 1972. Funds began to be available to our predecessor organizations around 1974. And this is what you would know today as the Lyons Township Mental Health Commission. This is also where we get like the Riverside Township Mental Health Commission. And if you come Saturday, you'll hear around this time, actually closer to 1980, is when we see the 708 boards of Berwyn and Cicero popping up. And so I forgot to change the slide, but this is the notations we have about the board kind of trying to talk through how do we convince the township to go for this referendum. And they partnered with Helping Hand and Community Memorial Hospital, present day Lagrange Memorial Hospital, present day Amita Adventist, to get this referendum passed. Oh, this is fun. Okay, I love talking about Constance Morris House. I could talk a whole hour about Constance Morris House. We're in the 1970s, and this is the time of the battered women's movement, which comes directly out of women's lib and also the civil rights movement. The first battered women's shelter was called A Woman's Place, the first one in Illinois. It opened in Urbana in 1971. And shortly after, we start to see rape crisis centers pop up across the United States too. In present day, Pillars Community Health has both a domestic violence shelter and we are a certified rape crisis center as an organization, offering hotlines and advocacy and such. Now at the local level, Brookfield Police in the early 1970s, good on them. They noticed an increase in calls about domestic abuse. And they knew there was this rising awareness in the community about it. And so they worked with Des Plaines Valley Community Center in Summit to explore the possibility of launching a domestic violence shelter for the area. It took a lot of months of advocacy by Florence Forshey and others that we'll talk about later in this presentation. But DVCC was able to zone a house in Brookfield, October 31st, 1978. And this is a drawing that one of the first residents did of that house. They also became one of the 12 founding members of the Illinois Coalition Against Domestic Violence that November. And that coalition we still belong to today. They were formed to use, to figure out how to use Illinois Title 20 funds, which help prevent neglect and abuse among children and adults. By this time, there's about more than 250 shelters across America. There are thousands today. They opened officially to the public on April 24th, 1979. We just celebrated Constance Morris House's 40th anniversary 2 years ago in 2019. They opened with help from the Sisters of St. Joseph, as well as Bethlehem Woods, and these volunteers decorated the shelter, helped find furnishings. Again, the community rallying together saying, we're gonna meet this need, right? And they opened with 5 staff. Now, I think one fun thing here, everybody says like, who's Constance Morris? She's actually in New York. So how do we get to that? Now, Executive Director Tom Jager gets together with the whole house executive director and they fly to New York City to meet with the Constance Rothschild Morris Foundation, who was interested in supporting the creation of a domestic violence shelter in Chicagoland. Now, Constance Lily Rothschild, she's the mother in this story, that is not her. Constance Lily Rothschild was a philanthropist interested in the needs of immigrant families and people experiencing homelessness. She married Ira Morris, who was from Chicago. And together, these parents, Ira and Constance Lily, encouraged their daughter, Constance Irene Morris, to get involved with issues impacting people experiencing homelessness. So they formed a foundation in the mother's name, Constance Rothschild, and they donated that money, if you're still following me, to the opening of our domestic violence shelter, and therefore the shelter was named in their daughter's honor, Constance Irene Morris. A portrait of her the daughter hangs in the Smithsonian. I don't have a picture of that here. It, to my knowledge, does not exist. I have searched the internet high and low. However, a bronze bust of her is currently for sale from a private collection in London. If you are interested, this is the bronze bust. Now, the opening, like I said, was in 1979. 9 years later, the domestic violence shelter would move out of Brookfield to its current undisclosed location. We could only have about 4 to 5 mothers and children in the shelter at that time. Now we're able to serve around 30 through that new location. And today we're serving people not just in residential, but on the hotlines through advocacy at the courthouses, at hospitals and such. And we will serve any gender, sex. You don't have to be just a female to benefit from our services. And this is a picture and an article this was in the staff newsletter from the time that the shelter moved. Now, at the same time, we're in the late 80s now when the shelter moves. Again, this is DVCC here, moving the shelter to its present day location. They also opened sexual violence services for the first time with 2 locations in Summit and Cicero. And these are kind of the slides that lead us to kind of where we are today with sexual assault services and domestic violence services, including our shelter. It's about to get interesting because 27 calendar in Lagrange lights on fire in 1981. This was the firehouse. This used to be the Lagrange firehouse. And in 1981, it catches on fire. There's an electrical fire in our building, and it forced a temporary move of the organization to the Lagrange Bank and Trust. The community took us in. The fire gutted the second floor and the roof, and the pediatric clinic and dental clinic closed for renovations. The nurses began making house calls from a makeshift clinic at the town hall. And shortly after that, pediatric clinic was reopened just a few months later. However, it took its toll on dental, and dental didn't open again until 2 years later in 1983. But good news is 5 years later in 1988, Community Nurse was able to expand its dental services and begin offering them also to adults. And in present day, we offer dental services to all ages, all income levels. No demographic is out of our range. So we really see the full arc in the 1980s for 27 calendar, going from an early fire to being able to expand services by the end of the decade. Now, I mentioned there were other people involved in the advocacy to get Constance Morris open, and that includes Ann Painter. Ann Painter was serving as Community Nurse's really de facto volunteer director for 30 years. She was succeeded by Ann Cuneo, pictured here all the way on the left, who became our first paid executive director at Community Nurse. But Ann Painter is an interesting figure in our history because she's one of these that, like Dr. Welford, crosses multiple organizations. In addition to her time at Community Nurse, she was on the 708 board, doling out mental health funds locally, and she became Lyons Township supervisor. So that put her in frequent communication with our other predecessor organizations, including Community Family Services and DVCC. And like I said, she did play a major part in helping Florence Forshea to get funding to open our domestic violence shelter, Constance Morris House. It wouldn't be a presentation about the 80s if I didn't include Oprah. So I had to throw Oprah in here. Now, Oprah was not in Lagrange, but she was in Hickory Hills. So DVCC, the year that Oprah moved to Chicago to start her show AM Chicago in 1983, DVCC had her out to do a fundraiser with them. And 3 years later in 1986, Oprah had really become a household name. 1986 is when she got the Oprah Winfrey Show and received her Oscar for her role in The Color Purple. But she was hanging out with us at DVCC. In fact, this is her with Florence Forshea at their dinner in 1983. So best believe I will be tweeting the heck out of Oprah Winfrey throughout 2021, trying to get her attention, and we'll see if it ever happens. If anybody has a connection to Oprah Winfrey, message me in the chat. So Berwyn Family Services is operating out in Berwyn, right? And you've got DVCC headquartered in Summit. They've opened their sexual assault services. They're running addiction services. They're running Constance Morris House. You've got community nurse in Lagrange running medical and dental and the community shop. I'm going to take a drink of LaCroix. And Berwyn Family Services, which is predominantly running psychotherapy and mental health services out in Berwyn, changes its name to the Fillmore Center. They get a large bequest to open a new building on Windsor Avenue from Lauren Fillmore. If you want to learn about him, come Saturday. And they rename both the building and the organization the Fillmore Center. We still have the Fillmore Center today. It is open Monday to Friday, 9 to 5. And we recently added, in addition to our mental health and social services there, we also now operate a federally qualified health center out of Fillmore Center with behavioral health services centered there. Now, what's interesting, obviously, about this slide is that we're in the 80s, and these three organizations that would one day merge are basically all using the same logo. And this does not include Community Family Services, that is at this time still operating on the same street as Community Nurse. So again, you see this like weird, cool congealing happening of all of our organizations, almost like kind of like spooky. Did they know that they were all using the same logo and they're all gonna merge someday? We'll never know. Moving on, we're in the 1990 now. Community Nurse adds a building, and we have this building today too, 110 Calendar Avenue. This is the one with the big light up sign on Calendar Avenue with our logo. And from the mid 1990s through 2005, they began running the area's first flu shot clinics. This is before you could just go to Walgreens and get your flu shot. So we were giving them out of local churches and then eventually partnering with stores in the area. And these clinics really were the first of their kind in the western suburbs and staffed by volunteers. And they also, Community Nurse also at this time operated a meningitis vaccine clinic before you could just go get a meningitis vaccine at your pediatrician. And those were in partnership with Lyons Township. Okay, we've got about 9 minutes left. I'm making my way. I think we'll get you through all of it. I'd love for you to see the whole thing. All right, 1992, Community Nurse purchases another building, 23 Calendar Avenue. As you'll remember, that was previously owned on the second floor by Community Family Services. And the bottom floor had housed Geist Shoes. So we moved the administrative offices of Community Nurse to the second floor, and the first floor became the community shop, moving it out of 27, the corner of 27 Calendar. So now we've got dental and pediatrics upstairs at 27. We've bought 110 Calendar for medical services, and now we've got 23 Calendar for administration and the community shop. That leaves the bottom floor corner of 27 Calendar open. And in 1994, they renamed the community shop the Carousel Shop, which many of you will remember. There was a children's carousel inside the shop, hence the rename. And Ann Painter and Joan Stone got the idea then to open a second resale shop in the corner of 27 Calendar, which they called the Corner Shop. And that would house furniture, glassware, items that could be consigned rather than donated. Eventually, the Corner Shop would be combined in 2017 with the Carousel Shop, and they would rename it again back to the Community Shop. So from 2017 until its closure in 2020, it was called the Community Shop, and it was on the bottom floor of 23 Calendar. I would be surprised if anyone didn't know that fact. Something else happens with Community Nurse in the 90s, and that is their fundraising efforts. New fundraising efforts emerge with the advent of the annual Lobster Bake. The Lobster Bake was held from 1995 to 2003, and again in 2016 and 2017, right before our 2018 merger. And here you see the community shop that was the result of these two shops coming together. But that wasn't the only shop. And in fact, if you read our full history in the coming weeks, you'll see that we had several thrift shops in our predecessor organizations. The Hope Chest sprang up around this time in 1995. Now, the Hope Chest is a separate 501c3. They are not part of Pillars Community Health, and they never were. However, they have, since their opening, their sole benefactor, they give all of their money that they receive as a donation to Constance Morris House. So we are their sole beneficiary. They provide it's upscale resale clothing, I'm sorry, but they also provide clothing to women residing at Constance Morris House, and that is still true today. Now, in the latter half of the 90s, Louise Hilligus and Margaret Katchadurian are on the DVCC board of directors at this time. And Margaret had an idea for a historic house walk to raise funds for the area agency. I'm sure many of you will remember the house walk. It ran from 1998 until 2013 in downtown Lagrange. And it was directed annually by one of our favorite Lagrange realtors, Joan Smothers. Now, also in the early 1990s, something happens that impacts where we are today, and that is that Florence Forche at DVCC hired a designer to create a new logo for Des Plaines Valley. That designer started using the phrase pillar of the community, and DVCC liked it, so they began issuing their own staff newsletter called The Pillar. Later in 1997, the Doings paper published photos of DVCC board members standing next to a column, and it said, "Come give money and take your place here as pillars of support." And of course, we all know where that's going. DVCC changes its name in 2000 to the Pillars Community Services. Emphasis on the. They dropped that later, but it's at the time, the Pillars Community Services. They launched the Harlequin Ball around this time, which later became the Pillars Ball, which probably everyone here knows about. And they purchased 333 North Lagrange Road, Suite 1, where we currently have our administrative offices in addition to 23 Calendar. Now, you got DVCC, you really got to follow me here. So if you're doing something else, pay attention to this part because it's confusing. DVCC changes its name to the Pillars Community Services, Part 1. Meanwhile, Community Family Services, those mental health groups that merged in Lagrange, merge with Fillmore Center that used to be Berwyn Family Services in Berwyn. So Community Family Services merges with Fillmore Center, and they become Community Care Options. You got DVCC on the left is now the Pillars, and Fillmore Center and Community Family Services is now called Community Care Options. That merger to create Community Care Options happens in 2002. In 2006, these two merge. DVCC, now called the Pillars Community Services, merges with Community Care Options to create Pillars. Now that is how geographically we kind of got where we are today. That's where we have the coming together of our office in Lagrange Park and Hickory Hills and Berwyn and all these, and Constance Morris House. So geographically, this is where we kind of start to see what we look like in present day. So now it's 2006, and now we're down from 8 organizations to 2, Pillars and Community Nurse. Now these two have been referring to each other through their predecessor organizations, maybe forever. But something happens in 2009, and that is the Community Memorial Foundation spearheads the community healthcare network of the Western suburbs. And Pillars and Community Nurse begin a more, shall we say, formal affiliation together through this network. Community Nurse then becomes a federally qualified health center in 2012. And by 2017, there's talks of a merger. We should join forces. There's a lot of reasons for this, and you should read the booklet to find out. But by 2018, we had merged, and now all of these services that you've been learning about for an hour are under one roof, Pillars Community Health. Okay, in 2020, we did not renew our Head Start grant. It is now being overseen by Easter Seals and El Valor, and they'll be using our space in Hickory Hills for that. And after 99 years, sadly, we were faced with maintaining a brick and mortar retail shop, which was exacerbated by the pandemic, and had to make the tough decision to close the shop. So 99 years later, I think I can say we probably had thousands of volunteers over 99 years. And we're very, very thankful for all of the time and commitment that was put into that shop. Today, we have 3 COVID-19 testing sites, a vaccine clinic, curbside visits for medical care, and of course, all of our other domestic violence, sexual assault, and behavioral health services. With that, I am going to attempt to find Miss Catherine Banashak here and stop screen sharing here for a second. And I'm going to let our VP of Philanthropy say a few words here. And Catherine, you can unmute and start your video. Hello.
Hi. Well, thank you so much, Jackie. Like Jackie mentioned, my name is Catherine Banashak. I am the Vice President of Philanthropy at Pillars Community Health. And I know it's 7:59, so I will be brief, but I've got a couple of important bits of information to share with you. But what a unique year to be celebrating our 100th anniversary. Such a celebration that we have in front of us. And while so many individuals and families are suffering from COVID-19, have endured family loss and severe economic consequences, we've asked ourselves, is this appropriate this year? And as our CEO, Angela Curran, says, all of this turbulence just makes it more important to celebrate a 100-year commitment to looking after our neighbors, regardless of race, income, or politics. This is a celebration of community. And we hope that you'll see the role your community, Lagrange specifically, has played, and all of us here play in stewarding this historic organization into the future. So we are so proud to commemorate our 100th anniversary this year, marking 100 years of service to our community through transformative whole person care. And wow, just so incredible to see the overlap from agency to agency and organization over the past 100 years. Despite the challenges each of us may face, when we come together to provide individuals the opportunity and access that they deserve, positive change is possible for each and every person in our community. It is our constant goal to realize this vision of giving all people access to care, and we're grateful and excited that you have chosen to be a part of our century-long mission in doing so. So a couple ways, if you'd like to get involved, we have some options for you. One is to volunteer. So I know, again, things are a little bit different right now, but we do offer a few trainings for our volunteer opportunities right now through our domestic violence and sexual assault hotlines, or through Buddy's Place, which is our childhood bereavement program as a group facilitator or greeter. You can work with us. We continue to hire throughout the pandemic. We update and post job postings regularly on our website. You can also make a donation in support of our services. Jackie has the website here, pillarscommunityhealth.org/donate. A gift to Pillars Community Health serves as an inspiring testament to one person's ability to bolster their entire community. Donations allow us to continue to provide the vital services we offer to your friends and neighbors. We would not be where we are today. We would not have the services we have today and continue to offer these services, especially this past couple of years through the pandemic and changes, without donations. So we are grateful for the support of the community. It has been incredible over the past 100 years. And I just want to say thank you all for the incredible role that you're playing right now today in your community by being here, by learning about our history and Lagrange and the roots in the community. We can't thank you enough, and just are so grateful for your belief in our mission to allow us to continue to do what we do day in and day out. So thank you.
Thanks, Catherine. Well, I will hang out here for another 5 minutes or so. We'll play some 20s music, and if anybody wants to ask questions or leave comments in the chat. Otherwise, thank you for joining us tonight, and we hope you can join us for additional events throughout our 2021 100th anniversary year. Thanks, Angela and Elizabeth. It's been fun. Thanks, Amy. Oh, wow. Elizabeth, that's pretty cool. Yeah, very new. In fact, our Senior Vice President of Domestic and Sexual Violence, up until just December 2020, Lynn Siegel started working at Constance Morris House in the 80s, but closer to the late 80s. Oh, great, Dawn. I'm glad to hear that. Definitely check out the stuff from the Lagrange Area Historical Society going on right now, too, if you want some more stuff from Lagrange. There's some pretty cool stuff over there right now. Oh, that's great. Thanks, Ian.
This is a real B&H country story. Fred Smith,
Dawn.
instructor and podcaster, started a new business. during the
Maybe we need to have some Oprah history. I don't know.
I was a fitness instructor in Atlanta, and I transferred to New York, March 13, 2020, right as the city went under
Brianna, we're very thankful for your contributions, and Hope Chest is a great place.
BNH's help.
I need to get over there and get some new stuff for my wardrobe, actually.
Cycling classes and off-the-bike classes.
Okay. Oh, how cool, Brianna. You're at Harrison 6th. I love that. It is. I mean, I feel like that one, I guess, like a large city block in downtown Lagrange. I mean, there's just so much history in that one area. It's pretty incredible. A lot of history right under our feet every day. All right, well, I thank you all for your comments and for hanging out. Everybody have a safe evening. Stay healthy. We'll see you soon. Thanks for being here, Angela. Everybody take care.